Okay. Okay, so good day. My name is Elaine and we're going to discuss about the assessment of vital signs. So I hope na you have read this topic in advance because this topic will be used for this profession from this lecture until mag-graduate mo. Okay, next. For the objectives, you can, after this lecture, you can describe and define blood pressure, its normative values, and the size of assessment. For the respiratory rate, you can now describe the breath cells and the adventitious ones. After the lecture, you can now define pulse rate, pulse rhythm, the quality, and even determine the size of assessment. With the temperature and koan, you can now point out the different locations of assessment and normative values of each. And then sa koan, you can now determine the normal variations of the vital signs and the factors that influence these changes. Also, with the pictures that I'm going to provide later, you can now determine the equipment and tools needed for the assessment of vital signs. So, proceed na ta. Before that one, I would like to ask someone, how many vital signs do we need to assess as a physical therapist? Okay, would like to call, okay, John Farley, how many vital signs will be assessed?
I think 5.
Okay, good. So 5. Actually, I'm going only to discuss 4 since I will not include pain. So the vital signs we're going to discuss today is pulse rate, respiratory rate, blood pressure, and temperature. So that nice one, Farley. So vital signs are important because they are the indicators of general health and physiological status. Also, the normal values have been established na for vital signs. However, nevertheless, it is important for medical practitioners, including PTs, to know these values because we can determine if these changes of the values is normal or abnormal as regards to the patient's condition. Next, kanang measuring the vital signs enables the PT to establish goals for treatment, assist with the development of the treatment, and assess the patient's response or treatment effectiveness. Yeah. You can see now person's vital signs may increase or decrease depending on the physical activity, on the environment temperature, on the or entire environment good, the person's age, then the emotional status of the person, the physiologic status of the person. And the physiological status that I'm saying is it includes the disease, trauma, the use of medications, and if there is illness. So let's start with temperature una. So temperature is the balance between the heat produced or heat acquired by the body and the amount lost. So temperature. Humans are warm-blooded, also called as homeothermic. Remember this term, homeothermic? Wherein the body temperature remains relatively constant despite changes in the external environment. I didn't place lang diha, pero the equivalent of the cold-blooded is 0 kilothermic. Okay, so the average temperature is 98.6 Fahrenheit or 37 degrees. It is the most generally accepted single value, but it all depends on what site you have assessed. So that value also is varied kanang sa depende sa isa person nag-assess, and even if male or female ba ang imong gi-assess. So see age and the assessment site. And if you can see the picture, there are different kanang sites na wherein imo siyang ma-assess. See, later lang sa value. We can assess the temperature through oral means, in the armpit, the rectum, and the tympanic. Tympanic, you'll measure the eardrum. And also, wala lang siya na-include diha. Kanang nakita na to sa COVID karon, what is usually used, di ba, kanang thermal scanner, ang sa may tungod nila sa inyong forehead. In which, ang gi-measure anak, kaya katong temperature, gikan kuno sa katong temporal artery. So, as you can see, na kanang, I said on the previous slide na magdepende rin na ang temperature ranges on the age and even on the pagka male or female sa patient. So, kita ninyo na varied yun siya sa age and even the site of assessment. So, you don't need to memorize that one because it is Fahrenheit. Yeah. Pero might as well remember its Celsius values kay mo may gamit diri sa atong country and assess niyo sa iyong patient. Next, temperature. Temperature gihapon, the normal rectal temperature. Please take note of this one kay usahon na nato og source which is the Fairchild and Pearson. Dito na ta makuha og values para mausa lang gid siya ba. Atong main sources ani is Fairchild and also physical rehab, okay? So, ang iyahang normal rectal temperature is 36.6 degrees Celsius to 38.1. The normal oral core or body temperature, core meaning inside. Kabano mo siya pasabot sa surface, mo ni siya ang makita. So, ang range niya is 36 to 37.3 degrees Celsius. To remember these terms such as hypothermia, hypothermia refers to the body temperature of a person in which ang iyang range instead of the normal 37 near to 37, it is within the 34 to 35 ang range. Hypothermia meaning low temperature. So if masubraan na gani siya ka low around 34 degrees, so marag you can say na 33 degrees naman from 37, pero it is already deadly to a person if ma-reach na siya lower than 34 degrees lower than. Yeah. Pyrexia, mo ni siyang opposite sa kuan, init. Pyrexia meaning ka ng fire, if kuan ka ng murag kani siya na term kung nasa volcano, di ba, it refers to something init. So pyrexia, wherein the person's body temperature is between 38 degrees to 41. So gilantan na ni si patient if nanani siya ingani na temperature. And hyperexia, so hypothermia, hyperexia, wherein ang kaning temperature sa person is more than 41 degrees, ang iwat sa 42, pero that's placed at 41, it would lead to death na gyapon. So, a little changes lang kanang on the temperature would really mean something on the body na, di ba? Di ba? You agree? Okay, thumbs up kung agree mo. Good. Okay, nice. So, ang your Pearson's gyapon on the table 31, these are the factors affecting the body temperature. So, pakita ninyo na kuan, the temperature is higher during the afternoon. Yeah, especially kung init ang lugar, init, mataas ba yung temperature niya? Ang mga kids kay higher temperature than us, then those who are stressed and those who are pregnant women, taas din ang ilahang temperature. So please read on your own pace kay it's very wordy and we would like to save the time to para dakan ta ma-discuss now. So, ani siya, see, because I didn't bring my thermometer, say, glove session na gini siya angay ipakita ninyo. So that is the tympanic thermometer, ipasok sinundunggan. Next, this is the axillary thermometer. I think you are familiar with this one. Kimonish is found in homes. And also this one. This can be used oral. Also, pwede po siya axillary. However, it is discouraged kaya if mabasag ang mercury, maka-poisonous na siya, especially sa tuwa. So, pero both can be used, pero preferably dito ka sa kanina lang digital. So, nanata sa pulse data, which is the second vital sign, which refers to the movement of blood in the artery. So, pulse is an indirect measure of the contraction of the left ventricle of the heart and indicates the rate at which the heart is beating. So, it is defined as a movement of blood in the artery. So, it can be palpated in various sides of the body or it can be auscultated. Auscultation meaning listening. So, madunggan na nimo ang pulse sa tao if imo itungod ang stethoscope, man mo ti stethoscope, di ba? So, imo na siya itungod sa apex of the heart. If you can remember, the apex of your heart is in the fifth intercostal space. So, please brush up your anatomy para ka nang bisod kayo i-prox, di mo katota sa apex of the heart. Next is, kaning pulse is, so, pulse, imo isuwas imong pulse is the beats per minute. Imo na siyang ihapon, pila ka beats per minute using your wristwatch. And mind you, na naatay ihuna-huna na pulse rate, pulse rhythm, and quality. So, bisag niingon ko pulse rate, we can assess kanang the rhythm and the quality of the heart by palpating or by auscultating. So, pulse rate sa tao na. Pulse rate is the number of pulsations or peripheral pulse waves or frequencies per minute. So, we have two types. Kaning importante na siya ng words ha. Kanang remember this one, bradycardia, wherein less than 60 beats per minute. Tachycardia, more than 100 beats per minute. So, pila man di ato ang kanang normal beats per minute. So, kung kinsay maka-answer, please unmute your mic. Okay, so
60 to 100.
Okay, good. So, 60 to 100, that is the resting pulse rate. So, remember these words ha? Kay, mindful ka dapat when you're assessing the patient with that. And pulse rate is influenced by the age. Pulse rate is influenced by the age, sex, emotional status, stress, physical activity level, body size, and stature. So, makita ninyo sa inyo gyapong Fairchild, the different descriptions on the factors affecting the pulse. So, ang mga old person, kinagi siya decreased pulse, ang mga athletes or katong kasagar na exercise, they will exhibit lower pulse rate. So, with this one, brush up gyapon na inyong physiology because it will explain nganong hinay man ang heartbeat sa mga athletes. Tungod na siya sa katong increased cardiac output. Siyempre, increased cardiac output, mas more blood ang ma-transfer. So, there's no need for the heart to beat a lot of times Mura kumbaga mas-suffice niya ang masend the blood with a few pumps, okay? Okay, next, pulse rhythm. Pulse rhythm is the pattern of pulsations and intervals between them. Yeah. Healthy individuals, the rhythm is regular and indicates equal time intervals between beats. Yeah. Arrhythmia, kay irregular rhythm in which the pulses are not evenly spaced. No. So, yeah, premature, late, or missed pulse ang imong timanan during assessment, and random irregular beats, imo na siya i-take note when you're palpating or you're auscultating. So, with the pulse quality, you need to take note on the amount of force created by the ejected blood volume against the arterial wall during each contraction. Siyempre, we are physical therapists, kuha naman kita, macro naman kita itong approach, so we cannot go into detail. What we're going to use is to note the pulse. If ma-obliterate ba siya or dili, mo niya itong guide to determine the pulse quality. So, ang table on your kuan, on the right side, which is found on your Sullivan, shows na kuan nila numeric pulse quality, wherein 3 plus na grade is normal, wherein ang ko nung imuhang pulse rate is easy to palpate, and for obliteration meaning i-hide, i-remove, or i-destroy, you need moderate pressure. So, beyond or lower than that is abnormal. So please read that one, ha. So next is, kuan. As what Ms. Althea said a while ago, the accepted normal range is 60 to 100. However, sa bata, paspas ang heartbeat. 100 to 130 beats per minute in newborns. And in children, taas gapon siya, however, lower than the infant, which is 80 to 120 beats per minute. So, kita niyo diha ang makita niyo diha ang different pulse measurement sites. So, kanang why man kailangan tag different pulse measurement sites? Because it's not every time na ang kaniya pong carotid diri magita manguhaw atong radial pulse diri, diri ta magtima, diri sige mageta ni kay nay uban cases na dili ta ka feel sa pulse. So we need to kanang magkwanta sa tong initiative na kanang palpate on the other pulse sites. Yeah, ang kani pong sa dorsal pedis and the posterior tibial, it would be useful in measuring na kanang patients who have DVT, who have deep vein thrombosis. Pero maybe this is so much for you to learn. This is a case that you're going to encounter on your later subjects. So, kani kanong pulse measurement, we can also palpate there when we are going to take the blood pressure. We're going to measure blood pressure. Then, in the laboratory session, the teachers will teach you how to efficiently and correctly measure these measurement sites, because your thumb has its own pulse. So the doctors will teach you how to unsay pagsakto, and even sa pag-take sa temperature, how to efficiently use wherein maka-measure ka pa og lain na mga vital signs while taking temperature. So dirita sa blood pressure wherein it measures the force. It is the force that the blood exerts against the vessel wall. So, muna siya. So, it is measured in millimeters of mercury, and recorded in the form of fraction. So, ato ipakita, wala siya diha. So, balik ta. Form of fraction, meron ang top number kay systolic ang pressure, bottom number, diastolic pressure. Dili na siya score, guys, ha. Dili na siya score, guys, ha. Mas dako ginasigi ang systolic pressure kaysa sa diastolic pressure, okay? Yeah. We need to take note of the Korotkoff sounds. Mo ni siyang imong angay kwaon, mo ni angay paminawon when you're taking blood pressure. And it often occurs, not often, all the times occurs in phases. Pero it needs constant practice and in any quiet environment para doon ka nimo klaro ang Korotkoff sounds, because it all happens quickly, it all happens once. So, only a skilled physical therapist or physical practitioner can know this one. So, muna inyong katunan sa inyong laboratory session. So, on the right side, Fairchild gapon ng source na to ani, nani siya 5 ka-phase. And, kita ninyo, ang pinaka-importante gid ani kay ang phase 1 o phase 5. Kaya ang phase 1 mo na siyang systolic, mo ni siya ang phase 1, ang phase 5 mo ni siya ang mahog na diastolic, wherein disappear na ang Korotkoff sounds. So, kaning 1 mo na siya pinakaklaro, ng 2 kay muffled, 3 is crisp, 4 is kanan na ay distinct and abrupt. So, read this one, ha. So, nagapan di siya factors na ma-affect mo sa blood pressure. Aside sa age, physical activity, emotional status, wherein kung stress ka, taas yung blood pressure. Depende po sa site of measurement. And also, cardiac output. So, please read that one because kanang it will be really be included in your test. And maybe I will also ask for this one during our evaluation, okay? This one, I prepared the list, kuan gyapon ni Fairchild, on the normal blood pressure normative values. So, makita ninyo, different yun ang value sa infants, sa children, adolescents, and adult. Diba? So, mind that one ha, ang kuan kanang atong normal na blood pressure for us adults is 120/80. Pwede ta mo sobra gamay, sobra ay mo paubos, pero not grabe. Okay? So, what are the factors di ay associated with hypertension? Kita niyo sa ubos, like may hypertension, stage 1 to stage 4. So, di pa kayo, mabala ka lang ta slide sa kaning pre-hypertension, 120 to 139. Yeah, ang diastolic wherein kuan siya, kanang higher than 80. So, diyan na sugod babala ka if it's more than 140. So, we need to determine the factors what would cause sa high blood. So, take note yun if kuan yun ka, kanang obese ka, or kanang imuhang weight is over sa imuhang body. Kung inactive ka, you have a sedentary lifestyle. Yeah. But if you have vices, you drink, you smoke, and you eat too much salt, you eat too much junk food. Yeah, if all of these kanang more siya kuan mura ba ang kaning alcohol, salt, o kaning especially kaning fat, mura ni siya mo-accumulate sa salt sa imong artery. Mo ni siyang arteriosclerosis wherein ang kay mo-accumulate pa siya sa imong blood vessels, ang katong imbis unta na dako ni siya buslot with arteriosclerosis. From the word sclerosis, meaning narrowing, gamay na lang kay agianan na imong blood. So, siyempre, gamay o agianan ng blood, mukusog yun siya og maayo para lang mubugwak ang blood to the other side. Mo na siya musaka ang blood pressure. So, diri, makita ninyo ang stethoscope. This is the one used in assessing blood pressure. So, namalit naman ka mo daan guys, or naghuwam na mo daan og stethoscope. Gamit kini siya kay lisod kayo, i-prox, kung wala may stethoscope, kay dili ta mo pagamiton og digital. Digital na manometer, kailangan manual, paminawon kininyo. And naano pod namo pod how to determine if sakto yung or bote na inyong kuan BP. We have a method, palpation. So, learn ninyo if you can outsmart us. Then, here you can see the mercury kuan, mercury gauge manometer. This is the aneroid kuan pa ni manometer. Mo ninyo kailangan gamiton inyong katunan. And syempre, ako lang ipakita ninyo unsa ni digital, mo yung panggamit sa mga makita ninyo sa inyong parents siguro, pero we will not use them in our practice kay dapat makaton jud mo. So, nito respiratory rate doon na ta. So, respiratory rate is the kuan, air inflow and outflow to and from the lungs and the environment. So, the physical components of kuan respiration includes respiration includes inspiration and expiration of air between the environment lungs. So, one respiration is equal to one inhalation and one exhalation. Mo ni siyang cycle. Kay mura unsay mo gigawas mo sa dimong ibalik, di ba? So, normal respiration requires minimal effort to inspire and essentially no effort on expiration. Syempre, maginhawat na, mura di feel ang air. We feel na to na magmulihok ang atong body. However, expiration, kay mura lang ni siya o kanang, if you can remember on your anaphysio, na ay lang recall during expiration. So, dapat kuan gani, effortless ha. So the pattern of breathing na siya pattern wherein na ubang thoracic breathers na ubang abdomen breathers. So ato na usa-usahon. So the thoracic breathers ang ilan ang thorax na maglihok, may elevate, may expand, di mo lihok ang abdomen. Bali naman po sa abdominal breathers maglihok ang ilang tiyan, ilang thorax kay relax. So if may try to determine if thoracic breathers mo or abdomen breathers. Usually females are thoracic breathers. Yeah. Sometimes na kanang if there is respiratory distress, magubang inyong pattern, both ang inyong gamiton, especially if kanang gilang di kayo sobrang hangin, so mo elevate, expand po na imuhang thorax and abdomen alternately or simultaneously. Sa respiratory rate, you need to remember this three terms ha, kay basi nga maglibog mo, especially mga nyam ni pinya, nyam. So with this nya, you have a difficulty breathing while at rest. So, kung man kayo difficulty breathing, yung ginanawan, you try to do so much effort. So, labored breathing. Orthopnea, there's a difficulty breathing when recumbent. So, para kahit naman recumbent, hindi nang higda. So, ang patient ani mangita ang way para mabalik ang iyahang kuan, karon na breathing by sitting upright or pagbarog niya. So, sometimes napon ni kaning kuan, apnea, which is the absence of breathing. Remember ha, dyspnea, D, difficulty. Orthopnea, O. So, meron siya o kanang you can make your own kuan ni mnemonics. Apnea meaning absence. So, since on the objective we are going to discuss man unta sa normal breath sound, so let's just make it quick pero basi magabi gid ni o kanang terms daghan gyud kayo ni maglibog mo sa adventitious of normal. So dili ko sa ta sa normal ha. Naay upat. Usa-usahan na to. First is tracheal. So this is best heard in the region. In the neck region na siya. I'm so sorry guys. So it is usually kanang high pitch, harsh, hollow, and loud. Then bronchial, it is loud, tubular, less harsh than the tracheal, and it is best heard on the manubrium of the sternum. Next is the bronchial vesicular, which is high-pitched. It is soft and best heard between the scapulae. Then vesicular, which is soft and low-pitched sounds, which is best heard over the periphery of both lung fields. So, kani siya, kanang dili pa kayo siya ninyo makakuha og kanang importance, pero i-POE ninyo next sem, if hopefully kay may buwan na ninyo kay tudloan mo sa inyong teacher on the different size asa mo maminaw ani inyong markings ani is this intercostal space ihap gid mo sa inyong ribs ani. Pero kung if you're in a amazing physical therapist na teacher ninyo butang ang inyong kuan kanang diaphragm or bell. So the adventitious breath sounds these are the abnormal sounds. So mo ni siya legit na very many ang i-remember. So it includes wheezing. Wheezing is the continuous whistling sound produced with the air passing through a narrowed pathway. So ang apektuhan ani is the bronchi and bronchial and is often compared to a whistling. So ang kani kuno next sa balon, kung imo na siyang di ba buslot sa balon ana man, kung imo na siyang mag-stretch o mag kanang mag hait kayong hilo kaayo, high pitch kaayo if kuan ninyo ang kuan kanang mo try to escape ang air. So that is wheezing. Stridor, harsh high-pitched crowing sound that occurs in the upper airway, obstructing, resulting in the narrowing of the glottis and trachea. So, harsh, high-pitched. Crackles, also called as rails, a rattling or bubbling sound that occur, which also the secretion in the passage of the respiratory tract. The sound is often compared to the rustling of the cellophane bag. Kani siya on your kuan sem puhon, your teacher is going to tell you on how to kuan kanang assess or kan maghimo og mga interventions for airway clearance techniques, but we're not going to discuss it first kay assessment pa man ta. Next is sigh. There is a deep inspiration followed by prolonged audible expiration. So occasional sighs are normal and is for the function to expand the alveoli. Pero frequent sighs are abnormal and kuan kanang maybe indicative of emotional stress. Stertor is the snoring sound owing to the partial obstruction, which is caused by secretion siguro in the upper airway. Upper airway includes the trachea and large bronchi. So, those were the adventitious sounds. So, mind you na ang kaning accepted normal range sa respiration at rest in normal adults is 12 to 18 CPM. Ang usa ka CPM is 1 inhale, usa ka exhale. That counts as 1 dili na ginhawa 1 lain na pod exhale. No, 1 cycle. And sa infants, syempre, kay gagmay mo nila lungs lang, so they need to breathe faster to suffice themselves with enough air. So, kailangan 30 to 50 cycles per minute ilahang water. Yeah, resting values above 20 CPM and below 10 CPM are considered abnormal for adults. So, more than is takip niya, ang below 10 CPM is predypnia. Okay? So, basahin niyo hang kanang salivan, kina dito ang sakto na term. As you can see sa right, these are the factors affecting your respiratory rate. So, mapektuhan ng respiratory rate if kanang tiguang ka, if you have too much activity, if kanang high altitudes, kanang if you have diseases. So, please read that one na siya sa inyong Fairchild, table 3-8. So, as you can see, it is affected by age man, no? Yeah, ningon ko dito na different ang infants and and adults. So you can see the kaning normal resting respiratory rates sa different ages from newborn to more than 12 years old. So magkahinay ang or magkagamay ang breaths per minute magkadako pero magkatiguang magkadaghan gapon. So cycle na siya. So many mo down sa kanang balik. Okay? So you can narin siya sa internet if you can. Pwede ra po din ako. I'll give you Manda PPT. So before that, let's have a quick test quick test and i-recap. Okay, so dili sa usa na ko i-flash sa screen ang next question. So this would be a tricky part na because it's really my fault. Okay, what are the two important phases of the correct cough sound? So I want Farley to answer this one and please give me a description on each phase. Kung something important too, I said it a while ago in the previous slides.
So for the phase 1 and 5. So
Mm-hmm.
phase 1 kay first faint clear tapping sound na detected niya mo increase in their intensity. So
Mm.
phase 5 kay essentially disappear totally. So
Mm.
the phase is also referred as the second diastolic pressure phase.
Good. So, this explains na kailangan kita mamino sa correct of sounds, no? Because ang first ug ang how would we know the fifth na kuan if dili ta mo agi sa second, third, and fourth phase, di ba? Okay. Next question. So, give me at least 3 sites where you can assess the pulse rate. Miss Althea.
Um, Temporal, carotid, and brachial.
Good. That is, then we have radial, femoral, popliteal, dorsal pedal, and posterior tibial. So, for the last question, again, takang Miss Isabella. So, please differentiate bronchial and broncho-vesicular sounds.
Uh, some bronchial sounds are loud, tubular, less harsh sounds that are best heard over the manubrium of the sternum, whereas bronchovascular sounds are high-pitched and soft and best heard between the scapula.
Okay, that is very good. So, yun na naminagin mo sa akong discussion. So, let's have a quick recap na lang. So, vital signs. So, dili ta ha, kanang discern resources, ana. So, dili ta dito lang to sa thank you. So, mag-recap mo sa ta quick guys, ha? Vital signs are important since they're the indicators of general health and physiological status. Varied ang value sa vital signs, depende na siya sa age of person, sa iyang activity, sa environment, sa emotional status, sa iyang menstrual cycle, and a lot of more factors. With temperature, normal ang 37 degrees Celsius. However, madepende na siya on the site assessed. Kay mas dako ang temperature na ma-record sa rectal area compared sa oral area. Nya, pyrexia is fever. Hypothermia is low temperature. Nya, kuan, there are also factors varying the body temperature. It is higher in the afternoon and a lot more factors that would affect temperature. Next is we can use glass mercury thermometer or automated in measuring temperature. Yeah, with pulse na ay pulse rhythm, pulse rate, pulse quality. You can use the katong grade scale for the quality. The rhythm is you need to identify if na ba siya abnormal or abnormal, irregular, regular, missed, beats. You're going to take note of that one. Pulse rate, you are going to count wherein in a minute, it should be na dili mo less than 60 beats per minute. Di po siya mo more than 100 in healthy individuals. Yeah, there are also factors such as physical activity and age who are who would alter the values on the pulse rate. So, dirita sa blood pressure, the normal blood pressure of a normal healthy adult is 120 over 80. Systolic pressure is the contraction of the left ventricle. The systolic pressure is the rest period of the heart. So we're going to listen to the 5 correct cough sounds, wherein the phase 1 is the most important and phase 5. Muna siya ito systolic and diastolic pressure na mabasahan na to sa atong manometer. So, magdepende na po na atong PT. Some of them would have hypertension wherein high ang ilahang blood pressure. This is due to obesity, arteriosclerosis, and also unhealthy lifestyle. And it also, we can use manometers and stethoscope, sphygmomanometer on measuring the blood pressure. We can use automated, we can use mercury gauge and aneroid ones. And last, for the vital sign na to discuss is respiratory rate. Now, normal is 12 to 20 for healthy individuals, and taay patterns such as abdominal and thoracic breathing. And kuan ni siya, and at times the patient would experience labored breathing, dyspnea, absence of breathing apnea, and orthopnea or heart difficulty in breathing while supine. And naay mga normal sounds such as tracheal, bronchial, bronchovesicular, and vesicular, and adventitious such as wheezing, stridor, cackle, sigh, stertor. And kanang varied ang atong respiratory rate because of our age, of our emotional status, physical activity, and other na mga factors. So, you can read all of this on the books I have provided sa kaning resources, especially kaning Pearson and Sullivan. Please read for preparations ato ang practicals and for the laboratory session. So, that is all, guys. Thank you, and I hope you have learned a lot of things today. So, Thank you, guys. Thank you so much. So,
Thank you.
You miss.
thank you so much.
Thank you, ma'am.
Thank you so
Thank you, Miss.
Okay, so bye.